Let me guess, you have tried fiber, you have tried water, you have tried even little pink pills or prune juice hacks, but you are still waiting on the toilet for something to happen. And after 60, that wait gets long and more frustrating. What if I told you the real reasons you are constipated after 60 aren't just in your colon, but in your nerves, your muscles, and your mates, even your morning routine? In this video, I am walking you through a complete science-backed strategy to poop faster and easier at 60 and beyond. Hi, I'm Bimal, founder of Gutsphere, and someone who has battled gut issues most of my life. This isn't just research for me, it's personal. I know how constipation can sneak in, slow you down, and take over your days. It affects your sleep, your mood, your appetite, and even confidence. And here's what most people don't realize. 1 in 4 older adults living at home deals with chronic constipation. And in long-term care, it's over 80%. But here is the thing. It's not just age. It's the medication, the lack of movement, the stress, the irregular routines. All of it disrupts how your gut works. And that's where most advice falls short. Just telling you to eat more fiber or drink more water is like handing you a wrench without showing you where the leak is. That's why this video is different, because you deserve a real, comprehensive and actionable guide. And if you stick with me till the end, you'll walk away with clarity, confidence, and a personal game plan to get your gut and your life back to track. Let's begin with what's really going on inside your body after 60. Let's get something straight. Constipation isn't just about aging. It's about changes that comes with aging. And understanding what's behind it is your first step to lasting relief. Constipation in older adults usually arises from a mix of factors. Let's walk through the major root causes and understand why they become more common as we age. Number one is dietary factors, low fiber and dehydration. Many seniors eat less overall and often don't get enough fiber or fluids. A diet low in fiber and chronic dehydration leads to hard, infrequent stools. Common culprits include insufficient fruits, vegetables, whole grains, and not drinking enough water. Older adults may also have dental issues, poor appetite, and difficulty preparing meals. These reduce food intake and limit fiber. And without enough fluids, fiber can actually backfire, causing more dryness and bloating. And the fix: gradually increase soluble fiber and ensure hydration with at least 1.5 to 2 liters of fluid every day, unless you are otherwise restricted. Now, nutrition is foundational, but it doesn't work alone. What your body does throughout the day also shapes your gut motility. So, number two, sedentary lifestyle. Physical inactivity slows down intestinal movement. Lack of regular exercises is a modifiable risk factor for constipation. Bedbound or very inactive seniors are especially prone to sluggish bowels. Movements helps move the bowels, so a sedentary routine contributes to infrequent stools. Even gentle movement like chair yoga, tai chi, or walking can make a big difference. Aim for 20 to 30 minutes of activity most days. But beyond movement and meals, many older adults deal with something even trickier: the medications they take every day. 3. Medication side effects. It is also called polypharmacy. Older adults often take multiple medications, and many common drugs cause constipation as a side effect. These include opioids, NSAIDs, iron or calcium supplements, blood pressure pills, especially calcium channel blocker like verapamil, diuretics, antacids with aluminum or calcium, anticholinergic drugs like certain antidepressants, allergy meds or bladder medications, and Parkinson's medication. Taking several of these together can severely slow bowel motility. Clinical tools like the Beer's criteria list many of them as potentially inappropriate for elderly patients because of the constipation risk. Reviewing medications with a pharmacist or a provider is key. Sometimes alternatives are available or a laxative regimen can be added preventatively. Medications are a big factor, but so are the conditions that come often with age. Number 4, chronic medical conditions. Underlying health issues often contribute to constipation in seniors. These include metabolic and endocrine disorders like diabetes, especially with neuropathy or poor blood sugar control, and hypothyroidism, which often slow bowel activity. Electrolyte imbalances like high calcium or low thyroid hormone and kidney disease also affect motility. Gastrointestinal diseases like strictures, diverticulosis, IBS, or past intestinal surgery may create mechanical or motility problems. And in any older persons with new onset constipation and red flags like bleeding or weight loss, colorectal cancer must be ruled out. But sometimes it's not the organs, it's the nerves. That's where the next group of causes comes in. Number 5, neurological conditions. The nervous system controls gut motility. Neurological conditions common in older adults like Parkinson's disease, stroke, multiple sclerosis, spinal cord injuries, and dementia can disrupt the signals or coordinations needed for normal bowel movement. In Parkinson's, for example, constipation may appear years before motor symptoms. Autonomic dysfunction slows gut movement. Similarly, stroke or MS can impair communication between the brain and the colon, making signals delayed or lost. And it turns out the mind plays just as much as a role as the muscles do. Number 6, psychological and environmental factors. The mind-gut connection is strong. Depression, anxiety, or cognitive impairment can significantly impact gut function. Depression is linked with reduced appetite and activity. Some antidepressants, like tricyclics, cause constipation through anticholinergic effects. Older adults in care homes may also lack privacy or consistent routines, both important for regularity. In some cases, trauma history or behavioral patterns like ignoring the urge to go can lead to chronic stool retention. Now let's move on to an area that's get most overlooked: how we physically push stool out. Pelvic floor or muscular dysfunction. Sometimes the problem isn't slow stool movement through the colon, but difficulty expelling stool. This is called defecatory disorder. Age-related changes in the pelvic floor muscles or anal sphincters. Pelvic floor dyssynergia, which is discoordination of muscles during defecation, or conditions like rectocele in women can all lead to outlet constipation. Older adults may strain without success despite having the urge, and years of chronic straining can lead to or worsen hemorrhoids and prolapse, creating a vicious cycle. Treating often includes pelvic floor retraining with biofeedback therapy. And finally, let's look at something subtler, but incredibly powerful: the gut's internal rhythm. That's number 8, normal aging and circadian disruption. Interestingly, aging alone doesn't necessarily slow down gut transit unless a person is very frail or bedridden. Research shows that higher constipation rates after 60 are largely due to multi-morbidity and polypharmacy, not age itself. This is empowering because it means many causes are reversible. That said, many older adults do experience disrupted circadian rhythms. Your colon is naturally more active in the morning and after meals. Irregular routines, eating at odd times, skipping breakfast, or staying up late can weaken these cues. Your colon clock, like the rest of your body, thrives on structure. So let's zoom out. Most older adults dealing with constipation aren't facing just one cause. It's often a combination: low fiber plus low movement, medications plus nerve damage, weak muscles plus disrupted routines. But the good news: every cause has solution. Relief is possible. Whether you start with a warm glass of water and walk, or bring this video to your next doctor's visit, start somewhere. Build that morning rhythm. Find your routine. Track what works. Make this a lifestyle, not a crisis plan. And if you want a little help staying consistent, we built the Gutsphere app. For people just like you, it's like having a gut health coach in your pocket. Track your habits, log your bowel patterns, follow personalized routine, and feel in control again. Because it's not just about pooping fast, it's about living light, aging strong, and feeling free in your body. In the next section, I'll walk you through how to fix each one step by step. If this video helped you, share it with a friend, a parent, or patient. Drop a comment below if you found something that works for you, and don't forget to subscribe for more gut-friendly videos. We are in this together, one smooth poop at a time. Let's get to work.